closing out our webinar today before our Q&A session and moving us into a discussion of the policy barriers and facilitators to more widespread access to telehealth is Mario Gutierrez, Executive Director of the Center for Connected Health Policy.
Thank you, Catherine, and thank you for this opportunity. The Center for Connected Health Policy is let's see here. We're an independent public interest organization that strives to advance federal and state policies. We are a nonprofit, and to that extent, we're not a member organization or receive any funds from industry. And so to the extent that our efforts, as we were funded by the California Healthcare Foundation as our core supporter and continues to provide support, to be a place where policy and information related to telehealth could be made available. In 2012, we applied for and were successful to receive a grant from the Office of the Advancement of Telehealth to be the National Telehealth Policy Resource Center. And to that end, we maintain a very active website. It's probably the most comprehensive website in the country related to telehealth policy and basically any information that you may be interested in related to telehealth. We're part of a network of 12 other regional telehealth programs around the country that provide support. And so to the extent that you're in any one of these areas, you should contact your local telehealth resource center for support, as well as the other National Health Policy Resource Center, the CTAC, which provides assistance related to technology. As we think about the policy world of telehealth, and I think it became very clear in our presentations here today, policy is not just public policy, but it also involves the decisions that are made by health systems and by provider plans. And as you can see, there's been a lot of creativity, a lot of support for embracing this world of telehealth. But in our work, we found that the single big obstacle for the advancement of care in telehealth has been the slow response from the federal and state policymakers to embrace telehealth care and to remove the barriers that currently exist that are unnecessary and to provide guidance in terms of reimbursement and other areas. We also believe that the influencers of these policies, both for federal policy and state policymakers, as well as to the private sector, has to come from both the changes in the technology world and from consumer demand, as we heard, but also very importantly is research. We believe that, and certainly policymakers are constantly asking for the evidence. And so to that end, we at the center have spent a considerable amount of time combing through the research and producing certain standards to be able to assess and compare studies, and also to ensure that they're in line with the triple aim of outcomes of quality, cost, and better patient experience. And so we're producing these studies so that they are available to policymakers to be able to go back and see what evidence there exists. Now, this is a particular one we just did on remote monitoring, and we have 3 others. It's really important, I think, to ground our in the evidence. The evidence is clear in many areas and continues to grow. So we've heard a lot about the triple aim and the importance in the context of how states and federal government are thinking about policy. The area that we think there's tremendous opportunity, and we've touched on a little bit on that on this webinar, has been as we move out of a fee-for-service cost-based reimbursement system where it's standalone care, illness care is what drives the services, into a more value-based pay-for-results, the opportunity to utilize these technologies is much more available. Certainly you can incorporate costs into your per patient per month, and as we heard from our colleagues in Florida, being able to fully embrace telehealth where you're not inhibited by the fee-for-service. It also is critical in the context of federal policy related to the Affordable Care Act and the creation of patient-centered medical homes, or person-centered health homes, as we like to call it, to be able to connect a team of healthcare providers in a virtual way, particularly for rural communities. This is critically important. and also for wellness care. As we move on to state policies, we, as part of our federal grant, spent a considerable amount of time combing through all the laws, regulations, and policies of every state in the country. As we were going into our work with the federal grant, we discovered that there was just not a single place anywhere where this information is available. Given the fact that this is the single biggest barrier, we felt it was important in terms of our public service to make that information available. And so on our website, and this is a shot of our website, you can see we have an interactive map where you can click on any state and according to 12 different categories, be able to determine what the laws, regulations, and policies are. You could also compare state to state. Our work in this area touched on a number of key areas that we feel are important. Is it defined as telemedicine or telehealth? That the movement toward the utilization of terminology of telehealth helps to incorporate other fields where this technology has been important, whether dental care, mental health, social services, substance abuse, any healthcare is being provided, virtual technologies coming into play. And so to that extent, it should be incorporated in statute. How is it reimbursed? What kind of modality, whether it's remote monitoring, do we have reimbursements for more than just video conferencing? Online prescribing is becoming more and more important. Issues around consent, cross-state licensing, et cetera. All these are areas that you can go to. And we also provide the source information so that you can click back to see where we found that information. There's not enough time to go through all of our findings, but I just want to click on some of the key areas that we found. Certainly the live video is the most common. What's most important, I think, about this side and most telling is that there's still 4 states in the country who do not reimburse even for live video under the Medicaid programs. Store and Forward, which probably has some of the most compelling evidence in terms of cost savings as well as quality of care in the areas of dermatology and in ophthalmology with diabetics. Only 9 states reimburse for that form of care through the Medicaid programs. And then remote monitoring, as we heard today, critically important for monitoring of chronic diseases and keeping people healthy at home, particularly the elderly. Only 14 states to date have any form of reimbursement for remote monitoring. Another area that's getting a lot of attention has been this whole notion of payer parity. As we heard, there's some concern about having any mandates related to how health providers or payers are doing this, and I think that there's a lot of language out there, and I think even though 27 states have passed some form of private parity laws, they're not all the same, and I think it's really important for your particular state to carefully the language. Many states use language that speaks to the terms and conditions of a contract of a payer, which provides the payer with the ability to determine what and under what circumstances they will reimburse for telehealth. Online prescribing is a big issue, particularly when we're talking about virtual care, things of the kinds of services that we've been hearing on this. In our research, we found that there are just a few states that actually allow explicitly in law or in regulation the prescribing without a physical examination listed there. Texas is going through some litigation, as many of you may know, so that's when it's a little bit more complicated. Minnesota and New Hampshire actually have specific language that prohibits the services of telehealth and virtual care without the in-person examination. Some of the more positive trends that we have noticed in the world of state policy is this effort to move toward a more comprehensive definition, as I mentioned, for telehealth. California, Nebraska, Wyoming, and I think obviously reimbursing for all forms of these technologies, Store and Forward, remote monitoring, and including those explicitly in legislation, regulations, and in those Medicaid manuals. Clear guidance to private providers. I think that's come clear in this webinar. There may be some ambiguity in terms of laws. I think it's really important that private providers understand, whether it's within the exchange or directly, what the rules and regulations are related to telehealth in that particular state. And then the question of out-of-state licenses is also getting a lot of attention. Some areas of concern, I think that it's really important that makers start to develop and write language related to telehealth, that they consult with groups like us and others to ensure that the language is clear and consistent and not contradictory. New York just went through a situation where what was some very fairly progressive legislation on telehealth, but within the language there were some elements that had to be cleaned up through amendments. Also, we're seeing some disturbing trends in the context of rather than removing, that some states are now actually starting to regulate telehealth and adding more barriers. So particularly when it comes to having to demonstrate that there's no provider available or that it's an undue burden for the patient, as we see in the Connecticut bill that we were just looking at. Just a few words on interstate licensing. This is probably one of the, in terms of practice, one of the biggest inhibitors of the expansion of telehealth and virtual care has been for physicians to be able to provide consultation across state lines. And so to the extent that the Federation of State Medical did an interstate compact that has now been passed by 9 states. They required 7 to activate that compact, and 9 other states that are considering that. This is a step forward. To be clear, it is not a telehealth license, but rather a simplification of the process by which physicians can apply for licenses in other states. We've seen more activities in the last few months and than all of last year in terms of legislation related to telehealth. I think this is a good thing, particularly when it comes to clearly identifying reimbursement and areas of licensing and definition. A couple of words on the federal policy. MEDICARE is outdated. The fact that they're still stuck and only reimbursing for live video and only for those patients who happen to live within a clearly defined health professional shortage area. It's time for Medicare to reassess and make these new technologies available, particularly for seniors' health and embracing remote monitoring as a real way of not only improving the quality but significantly reducing costs over the long term. There has been some encouraging efforts on the part of CMS in terms of moving toward more value-based care. I think Karen DeSalvo made a very good case, and clear that we're moving in that direction. Although there have been some recent language in the final rule for accountable care organizations that actually does not go far enough in terms of allowing for the use of telehealth. And to that extent, there have been a few code changes that I think are encouraging. A new code for non-face-to-face chronic care management and coordination, but there's much more that needs to be done. And then finally, I think on the federal side, the language in the next generation ACO, I think, really points to the future to allow for greater access for the broad range of services, including skilled nursing facilities, and to actually allow for incentives for the uses of these kinds of technologies and remove any form of geographic restrictions. Unfortunately, only 20 pilots will be funded in the first 2 years, so we still have a ways to go before we see these kinds of transformations take place within the Medi-Cal program. And with that, I'd like to thank you for inviting us to be here. Here's our website, and we certainly invite you, if you have any questions related to policies, either at the state level or federal, to please contact us, and we'll be happy to help.